All right. Good afternoon, everyone. Like Eric said, we are the symptoms and transmissions team of typhoid fever. All right. So first, typhoid fever is caused when an individual consumes the Salmonella typhoid bacteria through contaminated food or water. Mostly, this goes through hand to mouth contact. So, for example, if a restaurant and a server were to go to the bathroom and not wash his hands, and he had typhoid fever, and he served food to a guest, that guest would now have typhoid fever. So symptoms gradually progress over a while, and if left untreated, symptoms can range and go all the way up to delirium or even a coma. So the goal of our workshop is to communicate the methods of transmission and symptoms of typhoid fever to the Bauchi community. So meet our team. I'm Ansh Soni. I'm a rising senior in Chicago, Illinois.
I'm Ananya, and I'm a rising senior at Mason, Ohio.
I'm Sydney Short, and I'm a rising senior at Villa Madonna Academy.
I'm Sean Ramirez, and I'm a rising senior in North Las Vegas.
I'm Mariana, and I'm a rising junior in Chicago, Illinois.
I'm Hallie, and I'm a rising senior from Fort Lauderdale, Florida.
I'm Libby, and I'm a rising junior in Arlington, Virginia.
Now on to causes and transmission. So humans are the main reservoir of typhoid fever, and feces and urine are the primary sources of infection and can transmit to secondary sources such as fingers, water, soil, and flies. Water can also directly transmit to the mouth of a healthy person, and disease can also spread on uncooked food such as raw fruit without a peel. So most cases of typhoids occur between July and September, and factors such as polluted drinking water, contaminated soil, open area of defecation and urination can lead to transmission of typhoid.
And now onto the common symptoms of typhoid. So for common symptoms, when dealing with typhoid, it's really important to know these common symptoms. So when you're experiencing them, you can see a professional. And so according to the CDC, the most common symptoms of typhoid include weakness, stomach pain, which can lead to diarrhea and constipation, headaches and nausea, cough, loss of appetite, and rose spots are a specific symptom tied to typhoid. And they're normally located around the nipple and umbilicus area, or like the belly button area. And they can also be located on proximal extremities such as the back. And there's also a condition known as typhoid state, which the patient will appear delirious, or they'll enter a coma, or they'll go into prolonged therapy apathy. And another complication of typhoid fever is intestinal bleeding, which is the most severe because it's the hardest to treat. And with host factors for typhoid fever, there's 3: age, gender, and immunity. Typhoid fever can occur at any age, but it mainly occurs between 5 and 19 just because of hygiene habits. And gender is also a major play into typhoid fever. Males typically are more prone to typhoid fever than females just because they're out more, and also the temperature of their blood causes the typhoid to enter their body. And immunity, immunity affects the impact of the antibody stimulation, and follow-ups with a healthcare provider are necessary because sometimes the symptoms will look like they're gone, but checkups are necessary because you want to make sure that all the bacteria is actually gone.
So continuing on, going on to severity and progression of symptoms, typhoid fever can progress, like I said before, from something as trivial as a headache to something as serious as a coma or delirium or a prolonged sense of apathy. So if during week 1, the symptoms are kind of simple, like headache, sore throat, cough, and a stepladder rise in fever, where it starts off low and it keeps progressing higher and higher, and it reaches stomach pain. By week 2, the Salmonella typhi bacteria has reached the stomach area, and there's enlargement of the liver and spleen. The heart starts slowing down, and the rose spots that are known to identify the disease appear. By week 3, if still left untreated, the patient enters what's called the typhoid state, where they undergo the apathy, toxemia, delirium, diarrhea, and coma. And multiple complications arrive, such as a chance that hemorrhaging and perforations due to the bacteria are deteriorating the intestinal walls. So diagnostic challenges of typhoid fever is that there's a lot of similarities, especially in the week 1 phase to other diseases such as ARIs with the fatigue and the stomach problems that appear with many other diseases, which makes it hard to diagnose. The main way of diagnosing typhoid fever is through a blood culture test. Another limitation is that the Salmonella typhi bacteria may not disappear even after antibiotics are delivered. So like Hallie mentioned, following checkups are required.
Impact in individual health. Some symptoms of typhoid fever are high fever from 39 through 40 degrees Celsius and follow step ladder patterns where it progresses. And if left untreated, it can last till 3 to 4 weeks. The death the death rates ranging from 12% to 30%.
Now to discuss the impact on public health. With an average of 9 million people globally falling ill as of 2019, according to the World Health Organization, healthcare systems carry an immense burden. To gain a better understanding, the former governor of the Bauchi state, Malam Isa Yuguda, stated that there are only 18 doctors to serve over 7 million people with only 6 medical hospitals within Bauchi, which causes an extreme strain on resources, healthcare professionals, and facilities. In addition, few hospitals have the blood culture tests necessary for diagnosis, which leaves unknown carriers receiving improper treatment until they experience severe symptoms. To reduce burden and strain on the healthcare system, prevention strategies are important to discuss. Proper sanitation is of utmost importance to stop the spread of typhoid. This includes clean water and soil, and the most crucial things that humans can do to stop the transmission is through getting vaccinated, washing their hands, and maintaining proper hygiene when it comes to disinfecting and decontaminating food. Now to discuss the socioeconomic impact. Rostow's model of modernization classifies Nigeria as stage 3 of 5, which this basically means that a handful of key new industries start to emerge in the national economy that helps drive further economic growth. In order for the economy to increase, Nigerians need to be in good health to work. By Nigerians falling ill with typhoid, this causes economic and workforce loss, as workers are not putting forth the same effort of value as they did in stable health. High-risk individuals as well, including children, are at a disadvantage because this could be due to their parents either not caring, not noticing the symptoms, or not having sufficient funds to get them the proper treatment.
So for high-risk areas, one of the many important factors in rising typhoid outbreaks is the climate. So wetter climates are more prone to floods due to like rainfall. And this has caused like buildup in bacteria and cross-contamination between water and food. Between July and September are also more show an increase in typhoid rates due to the heat. Poverty also affects the rates due to lack of clean water, food, proper sanitation, and hygiene products. Communities where typhoid is common includes areas lacking toilets or running water. This is because transmission with typhoid is involved with stools or feces. So areas lacking toilets can cause a buildup in feces, which can cause rising typhoid rates. Typhoid cases can also increase due to people using cultural healing, which would cause people to not go to hospitals and would rather use their cultural healing to get rid of the typhoid. And in other communities, females need permission from their husbands to go to hospitals. So this can make it extremely difficult for females to seek treatment for typhoid. And areas containing children of those aged 5 to 19 are most at risk. So schools are a big area. And additionally, men are typically at further risk for contracting typhoid. And compact households, such as households with maybe 7, 8 people, can also make sanitation a lot more difficult. So transmission between the family could increase. And also people with underlying conditions tend to have weaker immune systems, which could lead to increasing typhoid rates.
The workshop is aimed to communicate the methods of transmission and symptoms of typhoid fever to the Bishop community. Our first activity will be an audio presentation discussing the typhoid fever in churches and in their prayer time and mosque. Our targets are parents to provide awareness. The second thing we will do is students/teachers awareness, where we allow teachers to learn from each other to educate students on symptoms of typhoid fever. We're trying to get the attention of kids through the ages 5 through 19. Kids from ages through 5 through 19 are the main individuals targeted by the typhoid fever.
All right. So for our first activity, we're going to be doing an audio presentation, and this audio presentation is targeted toward parents that are attending religious services. And the audience is parents because, as you've seen in the slides before, kids are one of the at most risk groups for contacting typhoid. So we want to make sure that parents are able to recognize symptoms in their kids. So for our audio presentation, the audio recording will detail the way the Salmonella typhoid bacteria travels through and infects areas of the body, especially important areas in the stomach and other areas of the body. This audio will subsequently be played weekly on Fridays in mosques and on Sundays in churches to maximize the amount of people that hear the audio presentation. An example of phrases during this audio recording, as you see up here on the board, will be when your symptoms change from sore throat to nausea, vomiting, or diarrhea, the Salmonella typhoid has progressed to your stomach. We hope that with this audio recording, we can derive a clear, concise message that will help families recognize the need for typhoid awareness and prevention.
For our second activity, we have a typhoid fever poster. Our target audience is both teachers and students. The teachers, because that's who we're going to be giving our presentation to, and they're going to be the ones diagnosing the students. And students, because that's the age that the typhoid is at the highest risk. And our goal for this is to enlighten school faculties located in Nigeria on how to recognize typhoid symptoms, because schools are largely populated with the student-teacher population. And this workshop will involve having large group presentations, which we will give to the teachers so they know how to identify symptoms in students early on. And it will be delivered to teachers from a variety of schools so they can deliver what they learn at these workshops to other teachers at their said schools. And we will also hand out pamphlets and posters, which we'll show a picture of in some of the next slides. And these posters and pamphlets teachers can hang up in the classroom and hallways of their school, and they can also give them to the kids and students and faculty at their respective schools.
So for our itemized budget, we'll be needing a speaker for the audio presentation, and this will cost $150. We also need a backup speaker just in case with electrical difficulties. It's always nice to be prepared, so that's $60. The posters that we're printing in color are $1 per copy, and so we will have 100 copies, which leads to the total for the posters being $100. Tape and batteries, which will aid the speaker, will cost $33 for the tape, and the batteries will be $17. And in total, this budget is $360, which is under our budget of $500.
So this is the handout we made to pass out at the workshop. And as you can see, it shows the typhoid fever symptoms. And this is to be hung up in schools, and teachers will put them on the walls.
And here are our resources.
Okay. Thank you very much, Eric's team or team 4. That was a very good presentation. And what I like most is the fact that you went truly home, looking at the burden on healthcare system, the availability of manpower, as well as the impact typhoid has on the health system in general. And just some few corrections. One is the issue when you mentioned compact households. And if, like you mentioned, household of 8, right? Did you? That would be considered small in Bauchi. I hope that sounds well, right? Over here, household of 8 is considered big, right? In Bauchi, if you have 8, 7, nobody would bother much. You are looking at household of 30 people, 20, 15 or more, or even more than 30 or 40. Okay, usually we have very large families. Then the issue of Ross supports in your poster, I think it's something that you may need to consider, because Ross supports usually do not appear in blacks. It's something that is more in whites and Caucasians, yeah. So we may have to look at maybe other symptoms, right? Thank you.
Very good job, guys. Your presentation was interesting, but I feel like you were kind of like bordering the line between comprehensive and like straight to the point. You did give a lot of information, but at the same time, I felt like it was too much information based on your presentation, because you touched a bit on prevention and things like that, and you're just transmission and symptoms, right? Right? Yeah. So that was like, okay, because I always have to look at Aisha to be like, are we just talking about transmission and symptoms? Apart from that, it was straightforward. I like the idea of giving out the handouts. I think that would usually work, like with the posters, and for your audio as well. Just to be clear, like the way it works, like with spiritual places, it's not like you want to play the audio while they are praying. It's something that can be done like afterwards when people are going back home, not exactly during prayer. Does that make sense? So it's not like I'm praying and you're like, typhoid is really bad for you, like in the middle of the prayer, you know. It's like when people are going out and then it's like an announcement that is going on to be like, oh yeah, this is the season of typhoid, be careful, and all of those things. Religious houses are great points because we're a very religious country. Like we go to churches, we go to mosque and all of those things. So those are really good places as well to let people know about the disease, but make sure that it's not in English, of course, and make sure that it's easy and something to remember that they could relate to. So always think about like, where are you doing it for and who are you doing it for? But good job.
Team 4, symptoms and transmission. I love how you dissected the transmission aspect of typhoid. Okay, you definitely showed hard work there and good research skills. All right. Yeah, like what Angel said, and with regards to the target audience, you know, the mosques and churches, religious centers. Yes, also I would have loved to get a context or like a full audio. You said you were going to play audio there, and is it like outside the premises or inside? Because back home, a lot of people advertise their products outside the mosques, especially on Fridays, because thousands of people attend the mosques, and then after mosque, the place is usually congested, like for the next 1-2 hours. Okay, so it will be good to indicate if it's within or outside. Okay, and if it's before or after prayer, like she said. And then yeah, other than that, everything was straight to the point. You know, the posters, can I see the poster again? Just okay. Yeah, the rose spots will have to be changed. Headache, even step ladder fever, maybe the simplify it. Okay. Yes, I love the dirty water and the dirty environment and the other one, but the symptoms, you know, you have to, yeah, yeah. All right. Thank you guys. All in all, it was a wonderful presentation. Good job. Thank you so much. Picture. You guys, pictures. Yeah.